Hello everybody. I am going to put my timer on because I definitely need to make sure that I don't rabble on about absolutely nothing. So hopefully you're going to learn quite a bit through this. And first of all, in your programme, it does specify that my talk is going to be on scar and lymphedema management, but they are massive subjects, and I couldn't really do both of them very much justice in 20 minutes. So I've decided to focus on scar management because Anusha did such a great job beforehand with lymphedema as well. But if you have any questions, you can either nab me in a break or afterwards on the whole lymphedema thing. So, first of all, you might think, well, who am I? So first, have you got that slide up? Yes, you have. I'm a physiotherapist, and it's quite a good idea to tell you what I'm not as well. So I'm not a dermatologist, and I'm not a skin cancer specialist. So I am speaking to you as a physiotherapist, and then you might think, well, what exactly has a physiotherapist got to do with scar management? Quite a bit. And the reason being is that if you have a scar that is causing you problems, then you might have dysfunction or you might have pain. And as a musculoskeletal physiotherapist, which is predominantly what I am, I deal with dysfunction and pain. So the idea is if we can try and make friends with our scar at quite an early stage, then we can prevent risk factors and reduce them so that we don't end up having scars that go a bit wonky. I'm also a multiple melanoma bod as well. I always struggle with the word patient. I did my master's a few years ago and wrote a 27,000 word thesis on service user acceptability for patient-reported outcome measures. The word patient gives us connotations that we are all like, oh, you know, patient, poor me, poorly. But service user can sound a little bit detached as well. So for the purposes of today, I am going to refer us all as patients. I am a patient, but I am a melanoma bod as well. So the next slide has got lots of me's on it. So I'm not going to have this up for very long at all because I'm like surrounded by me's. So I've got lots and lots of scars. I was first diagnosed in 2015, and I have gone on to have, I think I stopped counting incisions at 36, but I know I've had over 50 now. So I am a patchwork quilt. I am completely covered in moles, and I had to really fight to be mole mapped, sadly. And certainly before I was mole mapped, they just kept hacking pieces out of me, which was very reassuring, but also it just meant that I was in a constant state of recovery from scars, ultimately. So this, I'm showing you this one because it's probably the most prominent. It's right on my forehead, and it absolutely looked like I'd nutted somebody for quite a long time. And I'm cool with that because I looked quite, you know, mean. So this first image, which will be on your left, is immediately after the surgery, and then I had 10 definitely not dissolvable stitches. That's the middle one. That's my little sprog with me. These are all selfies, by the way. It looks like I don't have anybody else in my life. I do. And then and then that's me at the bottom, and that's me last week. Yet another selfie. And so that just kind of shows it's gone from being something really quite awful to something that I don't really notice anymore. It's important that we do look after our scars for lots of different reasons. One of the most important reasons, though, is because they are constant reminders of the fact that we have had or we do have cancer. And sometimes we don't necessarily want all of those. I mean, I've got a whopping one every morning when I look in the mirror, but I look at it as these are the bits that have been cut out of me because it's keeping me alive. So I'm quite privileged to have as many scars as I do. So let's get rid of me. So, no, obviously I'm still here. So what I hope that you will learn from the rest of me jabbering on is what a scar is, different kinds of scars, early intervention and prevention, why we would do that, what you can do to make a scar look and feel better, and know that sometimes even after our best efforts, scars can still go a little bit wonky. And if they do, I'm going to suggest some things that you can do in order to get help. So first and foremost, scars, what are they? So it's collagen fibers, ultimately. So we've got type 1 and type 3 collagen fibers. And not to bore you too much with all of the science, but collagen fibers are like a rope-like structure. So you've got like a thread, and then you've got a loop of it kind of coming around. And they usually lie fairly straight within the skin. They are, collagen is what kind of hikes everything up. Anybody that's perimenopausal will know that collagen definitely goes bye, and everything falls a little bit. So that is lack of collagen. So scars are extra super duper collagen. So it's the same stuff, but there's lots of it. And what they do is they will attach one side to the other. So we need that. We can't get away with that, and we definitely want lots of collagen. But after a while, what can happen is that if you imagine, I'm going to use an analogy that I use with children quite a lot when they have muscle problems. So I work with neurological disorders in some children as well, in pediatrics. And when we have a bit of an issue with collagen or muscle fibers, but obviously we're talking about collagen today, it can end up a little bit like cooked spaghetti. So if you imagine, we would like our collagen just to be all nice and lying, fairly nice and flat and smooth and like uncooked spaghetti. But when things go on the wonk, you can end up with a bit of cooked spaghetti. And what that means is you can have different kinds of scars. So you can end up with something called a hypertrophic scar. And that's where you've got extra collagen fiber, but it stays within the scar. I'm doing this because obviously I'm showing you my own forehead, my own scar. So it would stay within the scar. If something is then classified as a keloid scar, that means that all of those extra fibers are grown out with the margins of the scar. So that's kind of you've got normal kind of scar tissue, then you would have hypertrophic, and then sometimes you can end up with keloid. Now, it is really important that we get to grips with our scar really early on, and the earliest to do that really is as soon as your scar, so, oh God, I have to go back, sorry. So if you imagine, oh, I haven't got one, sorry, I thought I did. It's where the stitches have come out. If it's dissolvable, don't worry about that at all. You don't have to wait till they've totally dissolved. But if you've got stitches that have, actual physical stitches that have to come out, wait till they've come out. Wait till your scar isn't weeping, it's closed. So that could be anywhere between 7 and 14 days. And it's at that point you want to be getting in with some good techniques, which I'm going to show you all about as well, or tell you all about, sorry. Why would we bother? Okay, so one, it helps the scar to look a little bit better, which is something that, I'm not very aesthetically driven, but I definitely didn't want that plastered across my head looking pretty mean for the rest of my life. So it was really important for me, for all of them, that they looked a little bit better. Again, those constant reminders. Scars can be really itchy. So they can drive you insane sometimes. The itch is constant. They can be very, very sensitive. So we can desensitize them by touching them, which might sound like counterproductive, but it definitely isn't. And they can become tethered. And certainly in cases of breast cancer, I see a lot of breast cancer patients in my clinic. I work in private practice, by the way. I jumped ship from the NHS a long time ago. But you can get contractures as well, cordon for breast cancer patients, but also I've seen it with sentinel lymph node biopsy as well. I've seen somebody with a little bit of cordon from that, and contractures. So what a contracture is basically where, I'll give you an example for the elbow. Say we had a scar that was coming across a joint, and if we hadn't looked after that scar and it became very tight and tethered, what it can do is it can keep our limb in a state of flexion instead of being able to fully extend it. So it does mean that there can be quite a lot of dysfunction with a scar that has formed contractures, or the contracture is the joint itself. So the muscles become really tight and the tendons become shorter, and that's how you have a contracture. It happens for lots of different reasons. We see it in patients with cerebral palsy for completely different reasons. But if you have a scar over a joint, then you have a greater risk of developing a contracture over time as well. Tethered. What tethered means is where that scar has, let's be honest as well, scars will continue to grow for about 18 months. So it's a long, long time. So it isn't just something that you can, do a little bit on and then, I've done a little bit of massage today, that's cool, that's me done, I'm off, that's fine. No, your scar tissue is going to keep developing for about 18 months. So this is something that you need to commit to. And I would suggest that the techniques that I'm going to show you, you do for a couple of minutes a day. Well, twice a day. a couple of minutes in the morning maybe, a couple of minutes in the evening. Now all of that might amount to just 5 minutes a day, and you might think, God, I'm so busy, I haven't got time for that. That's 0.5% of your day that you would be spending on something that could significantly change how that scar develops. I'm going to repeat that. 0.5%. I defy anybody to tell me they haven't got 0.5% of their day to look after their scar. So please do. Anyway, that's, I'm not going to tell you what to do. I'm just going to make some very firm suggestions. So what do we actually do? Let's get to the meaty bit. What do we actually do? How do we actually look after our scars? So we've got a fairly healed scar. We haven't got any scrappy bits. We haven't got any scabby bits. There's definitely nothing coming out of it. Still might look a bit, but that's all right. If it looks red, if it feels funny, that's all well and good. You're expecting that to happen. What you need to do is you need to get something that you like using. There are so many people that really like bio oil for scars, and there are other oils available on the market. I would probably dissuade you from using an oil because it's quite superficial, and what will happen with an oil is it will create too much slip, whereas what you actually need is you need a little bit of traction. My favourite, I've used it since the beginning because it's a cream that I've used forever, is Weleda Skin Food. The actual original stuff, you can get lots of different versions of it now. It's quite thick. You need the tiniest little dot, teeny. And all that's doing is that's just providing a little bit of slip, but giving you lots and lots of traction. Vaseline works just as well. So you don't need to spend any money on anything. But I would probably avoid oil if you're actually wanting to massage your scar. So say, for example, I've got a scar on my forearm. That's probably the one place I haven't got a scar yet. And what you would do is you would start with maybe cross-fibre frictions. So you would get your 2 fingers and you would apply quite a bit of pressure. You actually want to see the skin moving. So it's not like, it's really getting stuck into it. This might be difficult to do, so maybe get somebody that you like, not somebody that you don't like, because they might press too hard. So you want cross-fibre frictions all the way across the scar. You know, I don't know, 30 seconds, whatever. And then after that, you want to do little circles. So tiny little, sorry, can you hear me okay, by the way? Or is this going on? Right. Tiny little circles all the way up. I would also go around the scar as well. So say this was my scar here, I would be kind of going right the way around it. Scar tissue can migrate and go into all sorts of places. Very typical example is with a cesarean scar. You can get a cesarean scar that hasn't been managed particularly well. Sadly, I've seen quite a few of these, and the scar tissue has just gone whoop, and then attached on the bowel and bladder and all sorts of stuff. And that's really nasty. So it's extreme, not frightening anybody, but just make friends with your scar. I promise you, it will definitely help. So you've done your circles, and then afterwards you just want to smooth it, because remember, we are trying to uncook the spaghetti. So you are smoothing the scar, which has kind of given the collagen underneath an idea of, oh, right, I've got a good idea what's happening here. So you're trying to smooth that over, and hopefully that will prevent lots of things from happening. So often or not, though, we have scars that are in places that we can't necessarily get to. And I'm going to sound like I don't sound random enough, but I'm going to sound even more random now. But on the next slide, I'm going to signpost you, if you want, to all of my social media. I'm a bit of a technophobe, only had a TV 2 years ago. I'm not poor, by the way, I just don't really like technology at all. However, I do post quite a lot, and it's all about education. As a physiotherapist, a huge part of our job is educating people on various different things, but we keep within our scope of practice, obviously. So one of the things that I've put on there is a video about how to make a peanut. And what is a peanut? A peanut is 2 tennis balls in a sock. Tie them together, make a little peanut shape, and that is going to be your friend if you have a scar on your back. So you're going to make like a bear, you're going to get next to the wall, I'm not going to demonstrate this, or on the floor, and you are going to roll around on those tennis balls to help to release that scar. So yes, you can't do your little circles, you can't do your cross-fibre frictions, you can't do your smoothing, but it is better than nothing. The other thing to remember as well is there are some areas of the body that will scar in not particularly nice ways. So it's generally the chest, and the back, and they will often stretch. So you'll start off with, as I did on the chest, with a lovely little, it was cut into the typical rugby ball, shape and stitched, and it looked all lovely and great, and I was massaging that, and then all of a sudden, over a period of weeks, despite everything that I was doing, turned into something that looked like a gunshot wound. So, I mean, I was looking proper badass at this point, to be honest, by the way. Gunshot wound, nutted somebody. So, yeah. And that's going to happen. So the one that I've got on my shoulder, that's kind of stretched a little bit as well, but it's not red anymore. It's nice and flat, but it has what we would call split. So the tissues have kind of, not opened, but they have stretched a little bit. So sometimes, despite your best efforts, some of your scars might still look a little bit on the wonky side, but they still shouldn't be causing you any real pain or discomfort. You can also get something called dog ears. I've had a few of those as well. So I've got a whopping one here from a wide local excision, and the ends of it, it kind of puckered up a little bit, and it was my favourite surgeon that did it as well. I mean, how bad is that? You've got a favourite surgeon? Anyway, totally have. He's gone as well. He's jumped ship. He's gone to Canada. I'm devastated. Anyhow, so you've got, come back. I did have little nodules on the end, and they're called dog ears. Now, we can have those revised. I would strongly suggest, well, one, they're not going to do it until after 18 months, because as we know, scar tissue will keep changing and forming for 18 months now. But I would strongly suggest that you just keep going with your 0.5% a day and really get to grips with that, because mine have flattened now and I don't have them anymore. And I'm really pleased that I didn't have to have more surgery, because as I've already told you, I've had quite a lot. You can also get, when I've mentioned cordon as well, it's a very unusual in sentinel lymph node biopsies, but quite common in dissections and in breast cancer cases as well. And that does literally feel like a cord. And you might need a bit of professional help for this one, to be honest, whereas a physiotherapist or another therapist that your team might send you to really get in there and kind of loosen it off and teach you the exact techniques that you need to loosen that cordon off. You will probably, actually, this is, I don't know. Do you want a little bit of participation here or not? Yay, no, it's just a question. That's all it was, 2. Right, so how many people here have had surgery? Doesn't have to be melanoma surgery. How many people have to go on, chuck it up? Yeah. Right, okay, bring it down. How many people were given advice on how to manage their scar? How shocking is that, man? That's why I'm here. That's why I'm here. It makes me really, 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 really sad. So please share this information with anybody that you know that's having a knee replacement or a hip replacement or anything. Anytime that we are being sliced into, we are going to have a scar. So if you can manage those in the best possible ways, then the hope is that you're not going to end up with lots of problems. You might still end up with a few problems though, and if you do, then definitely go back to your team. Skin cancer nurse specialist is probably the first port of call, and they can look at doing scar revisions for you, not them themselves, but they can refer you for that. And that's if things go proper wonky. I know that you can get super creams for keloid scars and all the rest of it. Again, I've had a keloid myself. Good old Vaseline and Weleda Skin Food did the trick. I didn't have to spend huge amounts of money on anything super unfancy. Half the time, they've nearly got all the same ingredients in them anyway. Oh, look at that, 1 minute left. So thank you, and this is me in text form. I am on all of the socials except X, Twitter, whatever that is. PhysioKel, you can find me on Instagram, and I post about everything. So Crohn's disease, because you know I'm a greedy bitch and I like more than one disease in my body, and I am frequently inhabited by cancer, as you know, so I often post about that as well. I've got 2 bonkers dogs, but also there'll be lots of information there about various different bits of physiotherapy as well. So if you want more work stuff and less sweary, then that's definitely Wellness Therapeutics, because that's me being all professional on that one. A bit of a mix today. And then I've blogged about cancer as well. Sometimes I blog all the time, sometimes I don't. It's always there, but quite often I do put it out in some sort of text form. And that is my blog if you want to have a bit of a laugh, because you probably will. Email, mobile, and that's my website. Please, please, please get in touch. I really, really don't mind. I stand up in front of generally lots of little children, because I do a lot of the Slip, Slap, Slop campaign. I said that without tripping myself up. How amazing is that? for skin. So I'm always chatting to kids, and that's probably why I'm so animated, about how to reduce the risks of melanoma as much as possible. And if there's anything that I can help you with regards to anything physio-related, or if you just want to blather about something melanoma-related, I'm no expert, but I'm getting there. So there you go. Thank you very much.